Well, when we look at the non-steroidals, we know they work by inhibiting both the COX-1 enzyme and the COX-2. Those are the potential mechanisms of action. If we look at a drug that we consider to be non-selective, for example, like naproxen, it inhibits both flavors of enzymes, isoenzymes. This means that you certainly are increasing the risk for toxicity, and it's not as selective for pain and inflammation. It also can impair renal blood flow and disrupt the mucosal layer of the stomach and so forth. So when you look at it, there are varying degrees of COX-2 selectivity among the non-steroidals. Celecoxib or Celebrex is the most COX-2 selective inhibitor, and then meloxicam is another that leans more toward a COX-2 selectivity. Obviously, the Celecoxib or Celebrex is a branded product. It's going to be more expensive. And head-to-head studies have shown if you take a non-selective drug like naproxen plus a proton pump inhibitor, from the perspective of the GI tract, you probably get equivalent outcomes with that combination versus a Celebrex. So you have to consider the cost consideration. Can the patient swallow the tablet or capsule? Do you need a suspension? But if you're worried more about the stomach, you would probably go more with Celecoxib or add a proton pump inhibitor to a neutral drug. And if you're worried more about the cardiotoxicity, probably naproxen, Celebrex at 200 milligrams a day or less are probably the most balanced in terms of not increasing the risk.